Hey guys, how's it going? Ross here from Fit for Life Physical Therapy. So kind of keep it in fashion of what the video has been going over the last couple of weeks. I want to talk about some soft tissue techniques that you can perform for your thigh muscles. So I've had a lot of individuals talk to me about knee pain or hip pain or even their low back pain. So really it's something that I think everyone should foam roll their quads. They're just overactive. You know, oftentimes people will say, well, isn't such and such weak? Potentially, but more so I just find that it's more of a movement efficiency. And if you just load strength on top of that, you're just creating dysfunctional movement. So, you know, worrying about the tissue pliability and soft tissue quality, I think should always come first before we start loading any type of stressor onto the area. So the simple techniques that we'll be going over are just using a foam roller as well as a dreaded lacrosse ball. And for the quads, I do prefer that we use the 3-foot foam roll. If you don't have one, don't worry about it. A 2-footer works fine, and the 1-foot ones work just as well. But really all you're gonna do at that point is just use one leg at a time, which allows for more pressure to be placed across it. So from here, I wanna just place the foam roller at the top of my thighs, and I'm just on top of it like a plank, so there's nothing fancy. And I wanna roll all the way up, as far up my quad as I can go, and I'm gonna roll down to the top of my knee. Now I want to make sure that I'm not rolling on top of my kneecap. I want to stop right where the tendon is. And if that's too painful, then you can really break the quad up into really 3 segments where you're working the top third and just do some small oscillations. You can do the middle third, where I generally find it's going to be the most sensitive, or you can also work right above the kneecap, just hanging out with smaller oscillations right on the quad tendon. You know, generally I find just doing 10 rolls or 20 to 30 seconds is really all we need at that point. If you want to make life a little bit harder on yourself, I usually will recommend a pin and stretch technique. So as my thigh is pressed down to the foam roll, I can do one leg or both at the same time. I just go through flexing it. So I find the hot spot and then I go through it 5 times. So this is going to pin the tissue down and then create a stretch of the tissue that's above the pin down area as well as below. So then I'll go and find another hot spot. And again, don't have to take very long doing this. I can also then shift my weight to the left. So I'm hitting more of the outside of my left leg. I could switch to the right, which again is going to cause a lot more discomfort. And if I want to cause even more torture, I can use that last pin and stretch technique with the lacrosse ball. So I'm just going to pin it right down, lay right on top of it. This is not a technique where I'll usually roll. And then from here, again, just go through the pin and stretch. Now the lacrosse ball is much smaller, so the surface area, because it's smaller, you're gonna dig a lot deeper. So this is gonna be a lot more intense. You know, and fish around. You wanna find all of those hot spots and painful areas because again, we want to improve soft tissue quality. Thigh muscles are very big. There's 4 muscles, that's why we call it the quadricep. So we want to be able to dig through all of them, but also allow for increased gliding between all of those different structures, whether it's the tendons, the ligaments, the fascia, so any type of connective tissue, as well as the muscles. So give this a shot, try it on both legs, especially if you're dealing with hip or knee pain, or if you're just tight in general. Again, a couple minutes a day is really all you need, but it's the consistency is what really matters. If you have any questions, just let me know. Thanks.